going to measure with the measuring device, and we're going to mark where the tragus of the ear and the midline of the scalp or the sagittal suture are. And so there's a number or a letter for each of them, and you want to find the measurement where the letters match. So for this baby, it looks like we're going to be going from For this baby, we're going to go from E to E, and we're going to use our marking pin and put a dot on both sides of where the arrows indicate. We'll do this for one side and do the same process for the other side. The baby should be supine in a neutral position for measuring. And once you're done, you should have 4 dots on the baby's head. The next step will be to use your cleaning solution, whether that be alcohol or ChloroPrep, based on your baby's size and skin. And we're going to clean the sites where we have marked. Cleaning the skin may wipe away your marker spots, so be cognizant of where you have marked. And when that dries, we can insert our needle electrodes. You'll need to kind of pinch the blue part and push the needle up. And you'll want to push back that little blue part pretty far back so that it's not in your way. Then you will insert the needles. All the needles need to be going the same direction, whichever you choose. So Danielle's going to enter the needles moving towards the baby's face, so the wires are going away from the baby's face. And you're just going to go barely underneath the skin. Once your needle is in, you'll take a steri strip and chevron it around the electrode to keep it in place. If the baby had a lot of hair, you would kind of part it out of the way as best you can prior to inserting the needle.
differences. We had originally thought you had to have separate colorings, all black in the front, all purple in the back. It does not matter. You can have colors on either side, all black, all purple, one purple, 3 blacks.
The next step will be to place a gel electrode as a grounding wire. So the first step will be to choose a location, which can be behind the ear, on the neck, or on the shoulder. You're going to want to choose a site without hair or with minimal hair, and take a small amount of your new prep gel to prep the area. And you'll just stick the needle electrode right to that spot. Now we can position the baby how we're going to keep him, and then get ready to plug in all of our electrodes. Once the baby is prepped, we're going to plug in the electrodes. So we will want to clip the monitor pack outside of the bed. So the long cords of the electrodes will go straight through a porthole slot. And you want to be sure to plug the electrode into the right spot. So on the diagram on the monitor, there's a nose, and that is the green spot. So that's going to be the front of the face. So make sure to plug in the 2 leads in the front into the correct spot, and the 2 leads in the back into the correct spot. And then the grounding wire in the center. Then you can pull the cords through the porthole slot and clip your monitor right outside. Then we will set up the monitor. So on the bottom right, hit the red circle for recording, and we're going to create a new session. Here you're going to enter the baby's MRN for the patient ID, the baby's last name, and first name. This is typically enough information to get started. Hit next. We're going to choose the 5 lead on the bottom, and then we're going to hit start recording.
Okay, so part of our new brains monitor, our old one had a few less features than the new one, and one of the new features of the new monitor is the background pattern classification. To go to that section of the new feature, you're going to click this grid box, and a new screen will come up that says automatic BPC, which is background pattern classification. This is something that the Olympic Brains Monitor enhances bedside neonatal brain monitoring by automatically marking your EEG trace with suggested background pattern classification. When you go to this screen, you would be able to see if your baby was having a seizure. The monitor is going to mark, and you're going to see marks. This is not a live patient, so we don't have a lot of feed, but you would see marks for seizure activity and then see your strip below. We would probably encourage you to not leave it up unless you're viewing it or a physician, and Xing back out by clicking the box and going back to your standard screen. Okay, so now we're in a live recording, but not on a live patient, so it's going to have up here under signal red. If you had it on your patient, ideally after you had placed your leads, it would show up green. If it does not, you can go down here into this picture of your baby's head and where your 4 lead placement with a nose references, and you will have options of green, yellow, or red. Green meaning your leads are in perfect position, yellow meaning that that's sensing some impedance to your lead, maybe coming loose, maybe a strip needs replaced, red meaning your needle is needing replaced. So it gives you 3 tiers, and you can pinpoint which lead is causing your problem of impedance. and not giving you a good rhythm. Also, under your added features of the new monitor is a review button, which will not be active because we don't have enough data on our new patient, but this will allow you to go in and review events that the monitor has picked up. That was also not an option on our old monitor. Just as a refresher, that's also on our old monitor is on markers down at the bottom. You can select markers, and it gives you a variety of options to quick select that you may be doing to your patient or making a custom event. So if you're doing cares, if you're doing a procedure, or if you suspected a seizure, you can also mark it. You don't have to rely on the monitor to mark that. It would be good to mark it under the marker section. That way when they go back to read, they can see everything that's been done and at what times. When you're finished with that, you can just go back to your main screen home button right here, and your recording session will go back.